there's been some specific studies which have looked at whether risk assessment tools are helpful. The first one we did was to give them in paper format to about 150 GPs 3 or 4 years ago. And the use by the GPs greatly exceeded our expectations. And GPs found them helpful, both in making the decision to investigate and in sharing the idea of not investigating with their patients. So they worked both ways. We also found in that same study that more cancers were diagnosed than had been diagnosed in the equivalent period before, suggesting that the tools were actually having an effect in terms of diagnosing cancers. What was even more exciting was that some of these cancers were early stage and therefore amenable to curative treatment. There's always been the fear that interventions to improve the diagnosis of symptomatic cancer may diagnose cancers that are too late in their pathway. This simply wasn't the case. There were some patients whose lives have probably been cured by that little study alone.
When you develop a new risk assessment tool, you have to be sure that it works and it identifies the correct people that you want and distinguishes them from the people that are at low risk who don't need further action. So we tested this in various ways using the routine data that we already hold. And we found that it was accurate at finding the right patients. We also had an independent team at Oxford University who ran the algorithms against data sets that they had and found that it worked in their setting as well. Once you've done that in the sort of quasi-laboratory setting of using data sets in university setting, you want to then take that out into the real-world setting to see whether it correctly identifies patients when GPs are using the tool in practice. So working with Macmillan over the last 3 years, we've been doing some pilot work with about 500 practices nationally to check whether the tool is actually usable and how it affects GPs' decisions. And we found that it does encourage GPs to think about cancer where they hadn't previously thought about it. So that evidence we've then used to feed into the further development of the tool to help to customise it and make it suitable for working in a busy GP's practice surgery. That information has then been used to help inform the development and the implementation of the tool now into the major GP system suppliers.